expecting you so soon. I just rolled out of bed. Come on in. This is our house, but also our lab. It's super studious in here.
So, like, I've heard that you are really into researching sleep paralysis. Could you maybe tell me more about that?
You know, sleep paralysis research has honestly been our life's work for as long as I can remember, so ask us whatever you want.
Perfect. Okay, well, just to start off, what is sleep paralysis?
So, sleep paralysis is a phenomenon that occurs when someone is temporarily unable to move or speak upon falling asleep or waking up. And so, during an episode, people have the impression of being awake and are aware of their environment, but they're unable to initiate voluntary movements. So they're just fully stuck in their body. And they may also experience a strong sense of pressure on their chest, vivid hallucinations, and an overwhelming sense of fear.
Oh, wow. Oh my God.
Yes.
How long does that last?
So it honestly doesn't last that long, which is good. So the episodes are usually a few seconds, but sometimes they can last up to a couple of minutes.
Okay, that like kind of freaked me out. How common is sleep paralysis?
So it's actually a fairly common experience, as about 8% of the general population report experiencing at least one point in their life. Things such as sleep deprivation or an irregular sleep schedule can be participating factors for sleep paralysis. And also, interestingly enough, it appears to be more common in psychiatric patients and also students.
Oh, wow. So I've actually heard that there's like different stages of sleep. Could it happen during like any of them, or is there a specific one?
So usually the stage of sleep that sleep paralysis is most associated with is REM sleep. So throughout the night, people are cycling through different stages of sleep. And the two main stages, as we know, are REM, which is non-REM, which is non-rapid eye movement sleep, and then also REM sleep. And so each stage varies in characteristics such as muscle tone, brainwave patterns, and eye movements. And in order to understand the mechanisms behind sleep paralysis, it's essential to first understand what REM sleep is. So it usually starts around 90 minutes after sleep onset, and it's characterized by rapid eye movements, irregular breathing and cardiac activity, a high level of brain activity, and it's actually similar to someone who is awake. And then EEG activity is going to show low amplitude, fast brainwaves with a desynchronized pattern. But the main characteristic of REM sleep that is important to us is muscle atonia. So during REM sleep, our skeletal muscles, is that how you say it?
Yeah.
Okay, yeah, good. Our skeletal muscles are atonic, which is leaving us temporarily paralyzed.
So could I ask you like a few more questions maybe?
You know, I'm actually so sorry, but I'm headed off on a hike. So.
Oh, yeah, okay.
Great talking to you.
Okay. Okay. Hi.
Hi.
Can I ask you a couple questions
Yeah,
about sleep
sure.
paralysis now? Okay, so I'm confused because I was told that muscle atonia happens during REM, but I don't really understand what could possibly go wrong in this step. Like, how does this relate to sleep paralysis?
Yeah, like she said, muscle atonia is an important characteristic of REM sleep. During REM sleep, we often have high levels of brain activity. In order to keep us safe and not acting out our dreams, our muscles are temporarily paralyzed. During this stage, motor neurons are not generating any action potential, and therefore we are not moving.
Okay, so does sleep paralysis always occur as a symptom of like another disorder?
It can occur with other sleep disorders like narcolepsy, but it can also just happen on its own without having a sleep disorder.
Oh, so what's that called?
That's called isolated sleep paralysis.
And what would cause it?
So isolated sleep paralysis is often caused by poor sleep quality, high levels of stress, or irregular sleep patterns. However, it can usually be resolved by maintaining a regular sleep-wake schedule cycle or managing cortisol levels.
So does it ever occur more than once?
Yes, that's called recurrent isolated sleep paralysis. This essentially just means that you have more than one episode of sleep paralysis. This is often linked to other medical conditions such as anxiety or depression. Some people with recurrent isolated sleep paralysis may take medications or use other forms of sleep hygiene treatments such as cognitive behavioral therapy to help with it.
Okay, so going back to the connection between muscle atonia and acting out your dreams, I'm kind of confused.
Yeah, I'm actually not sure. You should talk to my colleague.
Oh, okay. Can I ask you a question?
Yeah, of course.
Okay, so, the connection between muscle atonia and acting out your dreams, could you explain that to me?
Yeah, so basically while you're sleeping, obviously you can be dreaming, and you might be dreaming about like running around, but you don't want to actually act that out while you're sleeping because you could accidentally hurt yourself, or anything. So your brain just suppresses muscle activity to prevent anything bad happening.
Oh, cool. So it's kind of like a safety mechanism.
Yeah, it is. It just keeps you laying still.
How does our brain do this?
Yeah, so it has to do with cutting off the motor neurons, which are what allows us to control our body. So to do this, certain sections of the brain, including the pons and the ventromedial medulla, will release neurotransmitters, specifically GABA A, GABA B, and glycine. And these are just chemicals in the brain that transmit signals by binding or connecting to receptors on neurons. So in this case, specifically the motor neurons. And so we need GABA and glycine to both be released at the same time. And then the receptors on the motor neurons will pick up the signal. And through this whole inhibitory process, muscle activity is temporarily disabled. Why don't you come upstairs?
Oh, okay. Who's that?
Oh, don't worry. She's just experiencing what happens when something goes wrong in those GABAergic and glycinergic pathways. She's not just experiencing like regular REM sleep muscle atonia anymore. She's experiencing the full-on parasomnia sleep paralysis.
Okay, so what went wrong in those pathways for that to happen?
Well, when our mind wakes up from REM sleep, the connection between our motor neurons should be disinhibited so we're not, well, paralyzed when we wake up. But if GABA and glycine keep inhibiting those motor neurons in the spinal cord while our mind wakes up from REM sleep, which, by the way, is due to excitatory orexin signaling and inhibition of the ventrolateral preoptic nucleus, by the way. Anyway, that causes sleep paralysis, okay? Here's the thing, though. Scientists don't really know why or how these pathway disruptions happen. It's likely a dysfunction of GABA and glycine transmission or of brainstem regions involved in sleep paralysis, namely the pons and the ventromedial medulla. However, like everything, more research needs to be done to understand the exact mechanisms that create such a damn mess of our GABAergic and glycinergic pathways.
Well, that's just another one of the mysteries of the brain, isn't it?
It really is. Oh my god!
Wait, I thought you were supposed to be on a hike?
I'm just feeling really taken aback after that. I need some time to recover.
Okay, sorry.
Oh, hey, do you mind if I ask you a couple of questions?
Of course, go ahead.
So I've heard that people see things during sleep paralysis. Is that true?
Oh, yeah. And it can be pretty crazy. Some people only see just like a shadow, but others can even see an entire giant in their room, and maybe even one that could give you clues for solving a murder mystery.
Oh, what?
It's a Twin Peaks reference.
Oh.
Anyways, it varies from person to person and also from night to night.
Okay, so seeing things. Would you say that that's sort of like hallucinations or?
Yeah, exactly.
Okay, and are there different types of hallucinations?
Well, yes, it varies from person to person in terms of research, but there are three main categories. We have the intruder, and these hallucinations have to do with sort of threatening presence and is accompanied by things like hearing footsteps or weird voices. Then we have incubus hallucinations, and this includes breathing difficulties, feelings of suffocation, bodily pressures. It has to do with sort of a compression of the chest. And then last but not least, we have vestibular motor hallucinations, and they're considered very different from the last two I was talking about, and they involve a feeling that's sort of like floating or flying or also falling, and they tend to be positively correlated with feelings of bliss and more happy than the other two.
Oh, okay, nice. Oh, wait, how'd you get over there?
Don't worry about it. Anyways, take a seat.
Okay, thanks. So we kind of covered the baseline of the hallucinations, but I'm kind of just wondering what is going on with the brain? What areas of the brain are involved in these?
There's still a lot of debate on exactly what's going on up there, but we could go over the sort of main ideas. So for intruder hallucinations, like we just talked about, there's more activity in the amygdala, which is heavily involved in processing fear. So especially when there's an involved threat. Your amygdala will kind of go crazy, and the heightened activity makes a sort of presence feel sinister or even dangerous. So during this, the superior colliculus of the brain is also involved. This part of the brain helps orient us to visual stimulus, which helps us detect potential threats as fast as possible. During sleep paralysis, the superior colliculus may be interpreted as external cues, creating a sort of illusion of a presence nearby, making it feel much more real than it actually is. Now, for incubus hallucinations, So we remember how this had to do with chest pressure, and this is thanks to the brainstem and its control of muscle atonia that we talked about earlier in REM sleep. So as we know, in sleep paralysis, muscle atonia lingers into wakefulness, and then since the muscles of the chest are also relaxed, the brain interprets this as sort of an external force on the chest, and our brains can misinterpret the relaxed state of the chest as being constricted. And then last, we have our VM hallucinations, which mostly have to do with, you guessed it, the vestibular motor system. This system helps control our sense of balance and body position. So in sleep paralysis, the processing may lead to the brain losing track of the body's positions in space. So this creates a floating or out-of-body sensation.
Okay, thank you so much.
Okay, we gotta get back to our research now, but thank you for talking to us.
Thanks so much for letting me ask the
Whatever.
questions.
Yeah, of
Bye,
course.
guys.
Bye.